Hi guys, I'm Sam. I'll be your host today for the PA Resume Mini Training. I will provide as much valuable content as possible in the shortest amount of time as possible. So let's get started. In your resume, there are 4 essential parts. You have your header, your education, your experience, and your skills. As a new grad PA, you should keep your resume as short and concise as possible. You want to deliver as much value as humanly possible without making it 3 to 4 pages long. That's a very common mistake we see among new grads with very, very long resumes. You only need a 1-pager, a 1 snapshot summary of who you are, and it's quick, it's easy, and it's to the point. So in your header section, you have your name, your first and last name, and your title. The title could be PA, PAC. You also want to provide your contact information, your phone number, your email, and a LinkedIn profile if you have one. This is completely optional. You want to write a 3 to 4 sentence personal summary statement about who you are and what you're about. One thing I would suggest is you eliminate your physical address. Nobody will ever send you mail unless they're hiring you, but you're not there yet. You're still in the pre-resume stage, so you don't need to put your physical address. You also want to eliminate your current city and state, unless you're applying for a job locally and you're applying to your employer as a, hey, I'm here, I can start tomorrow. If that's the case, put in your city and state. Now, if you're not applying for a local job, it's an out-of-state job, you want to get rid of your city and state. And the reason why is because most employers know that out-of-state candidates are expensive hires. This means they require a lot of relocation assistance. So employers typically prefer to hire local candidates just for the ease of interviewing and hiring. And it's just so much easier because you can just hire somebody and they can start within a week or 2. Whereas an out-of-state candidate, they have to move across country, adjust, and find housing, and it would take about 2-3 months. So listing your city and state is actually not a good thing. A lot of times they have this applicant tracking system where they can filter out you by your city and state. So if you are somewhere really far or you can't hire right away, you can't work right away, you might not even get your resume reviewed by a recruiter or a hiring manager at all. So not recommended. Now, let's go and talk about your personal summary. Your personal summary is the most valuable digital real estate in your resume. It's the first thing that recruiters or hiring managers look at, and it really sets a tone for the rest of the resume. So the goal of your personal summary is to really capture that hiring manager's attention. And you only really have about 6 seconds. All it takes 6 seconds for you to initially view your resume, screen it, and decide if they want to give you an interview or not. 6 seconds, that's all you get. So you have to use that time to really persuade them to invite you for a job interview. And you do this by providing a really brief overview of your personal identity. It's a snapshot of who you are. You want to highlight your skills, your experience, and your accomplishment in that personal summary. That's only like 2 to 4 sentences, so be very direct. And you want to make sure you tailor your personal summary statement to a specific job you're applying for. So not just saying, I'm a PA and I want a job, I want any job. You want to be very specific. I want a job in ortho, I want a job in ENT, I want a job in primary care. Whatever it is, you make sure it is known to your employer that this is the job that I want. So you want to be direct, you want to show your value, show your impact, and show why you're a good fit for that position right away. Because again, 6 seconds, that's all you have, 6 seconds to capture their attention. Now, this was a personal summary that was given to us in the Happy PA Academy, so I'm going to give you a quick example, and let's call this person Susie. So Susie writes, a recent physician assistant graduate who's ambitious, motivated, and enthusiastic team player with a drive to grow professionally in a surgical setting, looking for a supportive surgical team to foster my enthusiasm and grow professionally in a collaborative environment. Now, looking at Susie's personal statement, did she do what we say she do? Did she add any value? Was there any impact? Do we know about her experience? Do we know who she is, what she's all about? Do we have any information about Susie based on this personal statement? No, right? We don't really know who she is besides the fact that she is a new grad PA and she's motivated, she's ambitious, and she wants to work in a surgical setting. There's no information here for the employer. Now, what's the major flaw here? Well, the first thing is Susie is just right off the bat telling us that she's a recent PA graduate with no work experience. So she's literally advertising her lack of work experience up front. Why would you do that? Why would you go on the first date and tell your date, hey, I'm really clingy, I cry all the time, and I'm just going to be a slob, my house is dirty, and everything. Like, you don't want to do that. You don't want to tell them all your flaws right away. You don't want to advertise that you have no work experience. Instead, you want to focus on the good things about you and why you should hire you and what value, what impact you can make into their business, into the company, into the team. So we know that most of the time employers prefer to hire experienced PAs over new grad PAs. And why is that? Well, because new grad PAs, they are a lot of work. They have to train them, and it's just a big investment in time and resources. And sometimes a lot of employers don't have the time to dedicate training new grad PAs. So most time, good employers prefer already well-trained, experienced PAs. And the providers that target new grad PAs in their ads, well, they're not the kind of employers you actually want to work for, because most of the time, these employers who target new grads, they target new grads for two reasons. One, they're cheap hires, and two, they know they can burn you out because you have really no boundaries as a new grad. You're excited, you're enthusiastic, and you want a job. So you take a really low pay, and they can work and burn you to the ground. And these are what we call churn and burn clinics. So churn and burn clinics are these employers that just hire new grad for cheap, work them like endlessly, give them so many tasks, all these things to do, and they burn them out. And they know that, okay, well, after 2 years, you'll probably quit, so I can find another new grad to replace you. And it's just like a vicious cycle. So you really don't want to work with those kind of employers. You want to find a solid, good employers who might not necessarily want a new grad, but they will still hire you because they like you as a person. And that's the employer you want to work with. So Susie here, she, in her second line, talks a lot about how she wants to grow professionally in a social setting. So she wants a social job. She's looking for a support team, and she's just excited and blah, 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 blah. But all she is doing here is telling you what she wants. So she wants a social job. She wants to grow her skills. She wants this. She wants that. She doesn't tell me what she can offer me. What is she demonstrating? There's no highlight of her skills, her unique accomplishments, or how she can bring value to the company. And so from an employer's perspective, what we're thinking is like, well, Susie, what's in it for me? Why should I hire you? How are you going to generate revenue for my business? How can you alleviate stress for my team, for my NP, for my PAs, for my scribes? Like, what are you going to do for us? Why should we hire you? So essentially, your personal statement summary should answer that question. Why should I hire you? What do you have to offer? And if you can't answer that question, that's a poor personal statement. Now let's give you a better example. So this is Gabrielle Jackson. She was one of our students in our Happy PA course, and she said this to us. Certified EMT turned PA with 7+ years of diverse healthcare experience as an EMT, medical assistant, medical scribe, sexual health educator. Completed 20 weeks of 5 different women's health rotation, inpatient, outpatient, OBGYN, IVF, breast surgery, women's imaging. She's highly versatile, resourceful, diligent, and reliable team player, able to remain calm under pressure, eager to join a family-oriented team dedicated to improving women's health outcome. So in this personal summary, Gabby is very, very specific in terms of what she can offer, what she's about, and what she wants. So we know here that she's advertising the fact that she has 7 years of medical experience outside of being a PA. So a lot of different various healthcare jobs. She's essentially obsessed with women's health because she did 20 weeks rotation in women's health. She had it in infertility, breast surgery, inpatient, outpatient, OBGYN, and radiology. So these are skills, her experience that sets her apart from anybody else who's applying for this job. So even if another new grad PA is applying for this job, they might not have 20 weeks of experience in women's health. So she is very, very valuable to them because she knows a lot about women's health. And you can tell here that she's a very clear objective. She's applying for a job in women's health. It's not neurosurgery, it's not ortho, it's not ENT. So it's very directed to them. And in her last line, she said, eager to join a family-oriented team. So in this word, family-oriented team, she's applying to a small independent practice, a family-owned practice. I know this because I spoke to her and I saw the ad that she was applying for. And in the ad, it said that they were a family-oriented team. They were a family-oriented small practice. So when she wrote this personal statement, it's very, very specific to that certain employer. It's not saying, hey, I'm a PA with lots of experience. I can do this, I can do that, I can do that. Like, no, you want to be very, very direct in who you're talking to. So very niched down. Now, what is Gabby not doing? Well, she's not highlighting the fact that she has no experience or that she's a new grad PA. She doesn't mention that she's a new grad PA. She's not advertising the fact that she has no experience. In fact, like if I look at this quickly, I might not even know that she's a new grad PA. I might have think maybe she has 7 years experience. If I didn't look at it close, I didn't read it closely, I might have missed out on the fact that she's a new grad PA. So that's actually a pretty key thing. You're not really tricking your employer, you're not lying to your employer, but you're adding so much value, so much content into who you are that they might overlook the fact that you actually don't have experience, because nothing here says that she's a PAC. None of this, the wording here, says that she's an experienced PA. It's not. It's an EMT turned PA. So it's very clear wording. Now, she's focusing on the value that she can bring as a well-rounded, highly educated OBGYN PA that creates a family-oriented team. So she's not focusing on the fact that she's a new grad PA. Hey guys, I'm interrupting my own video to remind you that you can download the PA Resume Blueprint. It is all this resume content in a PDF format just for you. And if you are enjoying this training, please hit the subscribe button and the like button to let YouTube know that we need more educational content and more PA content. And with that said, let's get back to the resume training. And now let's move on to the experience section. Now in this experience section, you want to list all your healthcare experience. And you want to make sure you list the most relevant position first, in the very top. It doesn't matter if it's the newest day or the most current position. So let's say before you entered PA school, you had a job as an EMT. And let's say you worked as an EMT and now you're applying to an ER job. So obviously an EMT and ER job is kind of related because you kind of see how the ER works. So you might want to put that up top, very, very top, even though that might not be your most current experience. So let's say you were a scribe right after that. Doesn't matter. A scribe is not as valuable as an EMT in the ER. So you want to put that experience up there. So include your job title, the company name, and the duration of the employment. Just basically keep it really simple, really short, and that's it. And underneath that, you want to make sure you bullet point the impact that you made within the company. So you're not listing job duties. One of the biggest things that we see that is a huge red flag among new grad is just list duties and duties and duties, like what I did. But you don't really need to list duties. You need to list accomplishments and impact on what you did for that job, as opposed to just your day-to-day responsibilities. So you also want to consider listing non-medical experience as well. So most of the time, your resume should be primarily healthcare experience. But if you held a leadership position or you possess a very unique skill, then you should definitely put that on your resume. So for example, if you were a barista at Starbucks and your only job was to make coffee for 6 months, I would eliminate that from your resume. It's not really valuable information that will be of use for your employer as a PA. But if you're a manager, you're some sort of manager position at Starbucks for 2 years, then yes, you want to put that on your resume because that is applicable. Everywhere you go, any job you take as a PA, you are a leader in medicine, so your managerial skills can be applied in this field of work. So keep that in mind. So healthcare experience is probably most important, but you also want to list any unique skill set. If you ever run a business, if you ever manage people, if you ever do digital marketing or ways to bring in more clients, more customers, more patients to a practice, put that on your resume. Very valuable skills. Now let's go through some job descriptions under the experience section. So this is for an ERPA. So St. Francis Hospital, Boston, Massachusetts, from June, this is the date, to now. So here's what somebody wrote. Provide direct patient care in a level 1 trauma center in the ER with an annual volume of 80,000 patients. Perform invasive procedures, including central line placement, arterial line placement, intubation, and lumbar puncture. Interpret diagnostic testing, including EKG, X-ray, CT scans, and ultrasound. So this looks like a pretty standard, pretty normal job description for an ERPA, right? But what is the problem with this description? If you look at this description, it doesn't tell you any achievement, any impact, and why you're valuable to the company. It just tells me what your day-to-day activities are. So how is that valuable? Anybody can tell you what an ERPA does. You can Google what an ERPA does, and I'll tell you exactly the job description. I know an ERPA does central line, does intubations, and does LPs. Now, a scribe, an EMT, a nurse can tell you the job description of an ERPA. You don't have to actually work as an ERPA to write out the job description. So this is really not extremely valuable information. What is valuable is your impact and what you did. So you want to focus on that. So listing out any day-to-day duties or responsibilities is not good. You don't need that. So most employers are already familiar with the role and the expectations of an ERPA. So you want to highlight your achievements, your outcomes, and your unique skill sets that set you apart from the other candidates. So let's try a better example. So here, Developed and implemented evidence-based protocol for the management of sepsis and acute coronary syndrome, resulting in a 30% reduction in mortality rates. Trained and mentored new PA hires, resulting in a 50% reduction in orientation time and increased efficiency in the department. Perform advanced procedures, including intubation, central line and arterial replacements, lumbar puncture, and wound repair with a success rate of 90%. Manage patients with acute myocardial infarction, sepsis, stroke, consistently achieving door-to-door intervention time within the national benchmarks. So here you have kind of the same content, the same information, but now you're adding numbers to it. So these are measurable outcomes. So we said that, you did central line, arterial line placements, LPs, wound repair, but now the only thing you added is this one section, a success rate of 90%. Well, how do you measure that? Well, if your patient didn't die, they weren't really super sick, and everything was great, you probably have a high success rate. Maybe not put the number, but you can say with a very high success rate. And you also might want to mention what the national benchmarks were. So what does this mean? So let's say for example, in urgent care, your employer say, hey, we want our patients to be checked in and out of our care within 75 minutes. And if you're able to meet that national benchmark, you would add that in there. Say, I beat the national benchmark by 5%, 10%, or the national benchmark was 75 minutes and I was able to obtain door-to-door intervention time to 55 minutes, or whatever it is. So you're highlighting the value that you bring, what you've done. If you have high patient satisfaction scores, you can say that your patient satisfaction scores were in the 80 or 90 or whatever percent. So basically, you're telling them what you did, but how you made an impact within the company and why they should hire you. So the idea here is just using quantified metrics to show impact. All it is impact. So how do you gather this data? How do you measure it? Well, if you're an experienced PA, you should be able to obtain a lot of this data by your company's reports. And this is really easy if you work in a really large healthcare corporation or a sector, because they love to send out freaking emails every quarter telling you what the benchmarks are, what the goals are, and how many patients you need to see. A lot of your bonuses might be in direct correlation or tied to these benchmarks. So keep these data and save it. What I suggest you do is save it, and they'll send it usually to your company email. You want to forward to your personal email to have the data on hand, so when you need it, you can have it to use in your resume. It's very, very important to quantify these data. Now, if you work in a smaller practice, you might not have these data because they don't do financial reports and they don't track as much KPIs, key metric performance, as big corporations do, but you can still kind of guess and estimate where you sit. And so your data doesn't have to be exact number, but approximate. And that's very important. So you can say how many patients you saw, or you can say patient satisfaction scores were, and let's go through what you can actually measure. So the one important one is patient outcome, reducing readmission rates, improving patient satisfaction scores, decreasing mortality, surgical mortality rates, increasing patient immunizations. This is especially important if you're in primary care or pediatrics, or increasing percentage of patients who receive preventative screening. So a lot of times in primary care, they do a lot of tracking for diabetes and compliance to colonoscopy, mammograms, all that stuff. That is all patient outcomes that you can measure. And also think about quality metrics, reducing medication errors, improving documentation accuracy, increase adherence to clinical guidelines, decreasing door-to-door time, increasing turnaround time when you sign up charts. So let's say they ask you to sign up charts within 48 hours and you can get them done in 24 hours. That's a quality metric you can measure. If you have less bounce back from the pharmacy, let's say the pharmacy expects a bounce back of 15%, and you don't get any bounce back because you always check your medication dosage and the right patient, the right pharmacy, the right name, and the right drug, and you don't get a kickback from the pharmacy, that's great. Put that in as a measure of quality. Financial impact. This means anytime you can increase patient volume by reducing costs through efficient use of resources, improving reimbursement rates. Think about leadership and teamwork, implementing new processes, new initiatives, training and mentoring staff. This could be training RNs, scribes, PAs, new hires, pre-living PA student. Those are all things you can add because that's leadership skills. Professional development, so highlight any certifications, any training, any CME trainings you took, any courses you took. These are all things that you can easily flex. When I say training, it could be, sexual harassment training, HIPAA training. It could be IUD insertion. I could be like robotics training. If you took a course on how to code, that's certification, and you want to add that year to year. So every year you go for your CME courses, every year you learn about women's health or you learn about diagnostic imaging, add that to your resume. That's impact. Every year you're adding value to your resume. You're growing yourself as a leader in medicine. Now, I just want to quickly measure this part because I see that very commonly among PAs who have entered a residency. And when they write their resume, they still advertise about that they're a student. They still list the clinical rotations. They still list all the duties they did as a clinical student. And I really don't like it. And the reason why is because a fellowship counts as work experience. It's a freaking job. You are a PA. You're working as a PA and you've experienced you have a lot of experience and a lot of skills that you've attained from this 1 year of experience. So you want to make sure you list all these measurable outcomes and list out the procedures that you're familiar with, robotics, ultrasound, reading images, or anything that you've done that adds value to the company. So list those to your resume. A lot of times people just act like a fellowship is just training. It's not. It's actual a job. It's a real job. So that is very, very valuable information to add in and just to really play it up to the next level. Now, I know you're thinking, well, Sam, what if I'm a new grad? I have no experience. I can't use these measures. I can't tell you about patient outcome. I can't measure quality metrics. Well, that's not true. You can definitely still measure all this stuff. Maybe not as your experience as a PA, but you can use it in your experience as a scribe, as an MA, as a nurse, as an EMT, whatever your pre-PA experience was. So you want to focus on relevant clinical experience, and you want to focus even on your clinical experience. So highlight specific clinical rotations that are relevant to the job you're applying for. So mention unique skills, procedures, patient population, or knowledge you gained from those rotation. So in our example with Gabby, she did 20 weeks rotation in OBGYN, so you want to put that in there. List out all the different surgeries that she was assisted in. List out any fertility training that she received. List out any maybe extensive training she learned about breast imaging or any kind of robotic procedures for C-sections or whatever that they do. Actually, I don't know. Whatever they do in OBGYN. Those are all really valuable skills that you can add to kind of boost up your skill set. And highlight prior healthcare experience that's not as a PA. Think about it. Your EMT, RN, all that good stuff. And leverage your abilities to read, interpret ultrasound images, managing team. If you're a lead MA, that's a manager position. If you implement new protocols, SOPs, you train new employees, you operate different lasers. So this is actually important if you're in derm. If you're in derm and you know all the different type of lasers that derms use, put that list all those lasers in that section. But you wouldn't want to list all the lasers used for derm in a job you apply for in orthopedic. That's irrelevant. So make sure it's very, very specific to that specific job. And that really highlights your strength and just add any kind of measurable data or outcome. Here's an example. So let's say you're an EMT and you can measure measurable outcomes related to response time and patient care. So response time, example, achieving an average response time of X minutes to emergency calls. So this is actually very common. So a lot of times EMTs are asked to respond within like 30 minutes, within 60 minutes of, with the time the patient called the ER. So you want to make sure you measure that specific number or even get a close approximation, responding to an X number of emergency calls within a targeted response time. And in terms of patient care, assessing and stabilizing X number of critically ill or injured patients, injecting X number of medication to patient in an emergency situation, coordinating amount of transfers of patients to hospital or to any healthcare clinics, meeting national benchmarks. Again, if the national benchmark is you want to take 8 calls, so let's say like you took 8 calls, you want to at least see 4 of them, and that's the national benchmark. If that's the case, you put that in there, that you meet the national benchmark, or you went above the national benchmark. If you're told that you have to see patients within 60, or be at the house by 60 minutes, and you did it in 35, put that on there. That's things you can measure. Very, very easy, very simple. And this applies to any field, whether you're EMT, nurse, RN, all that good stuff. Now, let's go and dissect Gabby's example. So Gabby's example, she did a pretty good job here. So she was really struggling when she came to us because she really wanted to have a resume that highlighted a lot of measurable outcomes with data, but she didn't really have a whole bunch of data to use. So what she did instead was she put one data as a first line, and whatever else she put in, she just wrote job duties, which is fine because you can only do so much. So for her job as an EMT, she put respond to over 500 calls and led a team of 3 to 4 EMTs during 50% of those calls. So she can actually break this down into quarters, responded to 50 or 100 calls for each quarter, or within 60 minutes time, whatever it is, instead of listing all these. But she was really struggling here. Same thing for here as an ER tech. She operated a clinic that responded to over 70 house calls per week. She could have said if she was on a team of 3, a team of 5. Oh, she did here. Collaborate with a team of 5 PAs to provide medical services to over 250 patients a month. But here, actually, under responding to over 50 house calls per week, was it as a solo EMT, or was she with a team of 3? Was she a lead team? Like, that's stuff she can add as well. Here, as a medical assistant, triaged over 30 patients in 8-hour shifts. She could have probably added a lot more detail in terms of what kind of patients she triaged it, how it was done, if she had full autonomy, if she was under the supervision of a nurse or with no supervision. That is very important. If she said, I triaged over 30 patients in 8-hour shift autonomously or independently, while obtaining, vital signs and fast-paced urgent care, and was, trained by blah, blah, blah. So add little spruce to it. So if you can put as much measurable outcomes, and then you can list whatever you can, but try to add as much as you can. Now let's move on to the skills section. So the skills section of your resume really highlights your skills and your abilities. And this section is really straightforward because it includes your language proficiency, your technical skills, and your soft skills. So examples of some skills you can list is fluency in languages. This is extremely important. If you speak 3 languages, put it up there. If you speak 2 languages, put it up there. You can read, write, and you can translate, put it on there. CPR, ACLS, BLS, PALS, extremely, really valuable skills. EMR proficiency, list out all the EMRs that you are familiar with in your clinical rotations, whether it's Epic, NextGen, Allscripts. And then Dragon is extremely valuable. If you're proficient in Dragon and you know how the software works and you're really fast and efficient, that is a skill that you learn because now you don't have to delay that learning as a new grad PA. Building and coding, if you're able to take a YouTube course on building coding, it's free. Or you write a PDF on the Medicare website about building coding for providers. That's also a skill you have. Any special procedures, so if you're in urology, these, TURP, robotic-assisted laparoscopic prostatectomy, those are all things you can list that are very specific to urology. Again, derm, very, very specific to derm. So any special training, IED training, removals, diabetes educator. If you're proficient in reading diagnostic imaging, so I used to be an ultrasound tech, so I highlighted the skill set, very important at every single job because it is very diverse in every, whether it's urgent care, primary care, orthopedics, urology, OBGYN, they use diagnostic imaging a lot. So I can run and know how radiology works and how to order exams. I know how to interpret and read ultrasound imaging. I'm very familiar with X-ray imaging. So I highlight that as a skill set, and I can use that no matter which field of medicine I apply to. So boost up your skill set and use that as a way to leverage the value you can bring to your employer. So here's an example of Gabby's that we'll talk about. And I just kind of give you some room for improvement. So here she listed her clinical skills. First aid and CPR. So I probably wouldn't put first aid and CPR. I would probably list out BLS, ACLS, PALS. That's a little more specific. And instead of using the word clinical skills, just put skills. You don't need to put clinical skills because you have a lot of skills that are not clinical. You have managerial skills. You can have skills with EMR. You have skills with Dragon, dictation, training, billing courses, HIPAA courses, sexual harassment courses. Those are all skills you have that are not necessarily clinical. So area management, again, is very vague. Phlebotomy, vague. Pap smear, I would probably not list any of this for an OBGYN job. Pap smear, you're required to not do a pap smear as a PA. Doesn't matter if you're looking for a job in a women's health PA or if you're looking at primary care or orthopedic, you have to know how to do a pap smear as part of your requirement as a PA. So this is really irrelevant. In terms of phlebotomy, you'll probably never use phlebotomy as a PA. Most of the time, you'll have a phlebotomy team, or you have nurses or MAs to do that for you. The only time you would probably put that in is if you're going to maybe in the ICU, where you're actually maybe having to draw blood and do a lot of like blood work for central lines and IVs. Maybe that's maybe relevant, but otherwise I probably wouldn't put that in there. But you do want to list special surgeries, special procedures you've done. Again, I said Dragon, EMRs, all that good stuff. So list all the skills you have, and language is a big one. So put in language skills. You can speak. If you have, if you're very comfortable with, how about LGBTQ training, or if you work with populations, very, very specific. If you're very good with geriatric, you've worked a lot of geriatric in terms of managing their health or polypharmacy. Those are very unique skills you can highlight in this section. It's not just like direct like CPR and stuff like that. And actually one thing that actually I didn't want if I do here, actually no, I'll get back to that section later. Let's go here. So in your red flag section, here's the thing you don't want to put is you want to use the word pending. Pending, that kind of alarms them, and it kind of sets the alarm that, hey, you're still a new grad or you're not actually ready to work. So I would avoid the term pending new grad student on your resume. So instead of saying pending license, you can say available to start June 2023. So you list, NCCPA, New York license, NPI, and then the bottom put available to start June 2023. And you want to make sure that you list out everything that is state specific and also national specific. Meaning, so NCCPA is national, but New York State is state specific. So let's say, like, for example, Nevada has their own pharmacy license. So you put, you have a DA license, you have a Nevada license, you have Nevada PA license, and you also have an NPI and an NCCPA. So list everything that's applicable. HIPAA, EMT training, all very good. And never use the word PA student or new grad PA in your resume. Again, that screams no experience, and that's not something you want to advertise. Instead, if you're not a PAC yet, use the word PA, because PA still technically means that you're in PA school, you're a student, or you haven't officially got your PAC, you haven't passed your boards yet, but you're still a PA nonetheless. Now, things that you avoid on your resume is, one, you really want to eliminate listing out all the clinical rotation description. I've seen this so many times among my students. They will give me a resume and it's like 4 pages, and they'll have all the clinical description that they did. Like they did EMTs, they did like 50 pap smears, they did 40 INDs, or they did like 5 suturing, whatever it is. They list all these things. That's not relevant information. And the reason why is because those are duties. That's what the requirement you have to have as a student to graduate PA school. So that's not a unique skill set. So if you're applying for a job in ortho and you've done a bunch of ortho procedures and a lot of ortho training, then put that in. Otherwise, leave it out. Like you see here in Gabby's resume, she doesn't even have any description at all. She only listed and bolded the ones that are relevant. What is she bold? OBGYN, women's health, reproductive endocrine infertility, breast surgery, radiology. So this gives me direct attention that, hey, this is very clearly an OBGYN resume. And this is just irrelevant shit. I mean, I probably would have just eliminated this part. I would have been put in here. But I'll tell you why I told her to keep it. And we'll discuss that in a little bit. But essentially, you want to make sure that people who's reading your resume, they know what it is that you're offering and what it is that you want. It's very clear objectives. So don't put all your resumes rotations, that's irrelevant. I would highlight in bold, even underline stuff that's relevant, and just eliminate things that aren't. So the reason I told Gabby here to leave these parts on her resume is because right here. Let's talk about this. So, when you market your resume, you want to be very clear in terms of what you're marketing. So if you look at Gabby's resume, can you tell me what she's marketing? What is she saying about herself? What is she selling? Well, if you look at her resume, it screams OBGYN and it screams New York. In fact, she has the word New York written 13 times on her resume. So what does this tell us? That she's a New York expert. She probably knows all the New York pharmacy companies, all the insurance policies, all the hospital and clinics in New York. And this is very valuable information. Why is that? Because if, let's say Mr. Jones comes in and Mr. Jones wants you to send a prescription to Rite Aid on Jones and Fort Apache. And you're like, haha, Mr. Jones, there's no Rite Aid on Jones and Fort Apache. Did you know there's a Walgreens? Did you mean Walgreens? She's like, oh yeah, you're right. It's not Rite Aid. I used to go to Rite Aid. It's Jones. So this saves a lot of time because she knows the streets of New York. She knows where the pharmacy companies are. She knows how to do prior auth. She's familiar with insurance companies and hospitals and clinics. And that is why I told her to keep the New York part on. Now, she also did all clinical rotations within multiple different New York Presbyterian hospitals. So she's very familiar with the EMR system, with how they run their system, with their core values and their mission and their purpose. And clearly she likes it. That's why she's applying for a job there. So if that is the case, it's very easy to market. Like, hey, I'm very familiar with your hospitals. I've done all the rotations here with them. So like, hire me. I'm an expert in New York, and I am an expert in your hospital system. I know how to function in this place. So when I start my job, there's much less learning curve. I can just jump in right away and get started with ease. So this is what she's marketing. So you look at Gabby's resume, there's a quick snapshot. It's easy. It's simple. There's no crazy letters, no crazy fonts, there's no photos. It's direct. She bolded the stuff that I needed to see. She eliminated stuff I didn't need. I didn't actually mention here, but you want to put a reference, name, and email, and telephone number. Simple, short, direct to the point. Don't put reference upon requests. Just put it in there. This stuff, I mean, if you want to fill up space, you can put it in there, but I don't think it's extremely relevant in that sense. It's only more like a space filler, because if you have more skills, you want to list out your skills as much as possible. And then leadership and honors, you can probably put in together, combine as one to fill up your resume space. But I would also actually put in skills high up here and then certification down here. But it doesn't really matter. As long as it's clean, as long as it's neat and direct, and people can get a quick snapshot of who you are, that's all that matters. So again, Gabby, straight to the point, 7 years experience, tells you directly up front who she is, what she's done, what value she brings, and what she wants in this one little paragraph. And their education is very short. Master's, bachelor, rotations, done. These are all the ones I did. These are the New York places I've done. These are the experience I've had. That's it. Really, really quick, really simple. And I mean, obviously there's some room for improvement, but I think it's a really strong resume as is. Now, if you have trouble writing a personal summary, which most people have, and writing descriptions, go use ChatGPT. If you've never used ChatGPT, it's an AI software program that you can write down just how you want to say things, and they can kind of redirect you and give you a lot more prompts to write a better resume summary and work description. And if you don't know how to quantify stuff, ask GPT. Say, hey, how can I quantify my experience as an AMT? How can I quantify my experience as an RN? What are some measurable outcomes I can quantify? And they'll give you a list of things you can quantify, examples, and it'll really help you. So that's a quick tip. So that is it for today. I hope this training was short, simple, and to the point, and you got some value out of this. If you have any questions, you can join our Happy PA Academy on Circle. We're launching that very soon. If you need a link, you can DM me, your PA mentor on Instagram, or it's Sam Mingo on YouTube, and send me a message, send me a DM. I'll give you a link. If you have any questions about your resume, let me know. I would love to help you. Our community at the Happy PA, we always share our resumes and suggest how to improve your resume so that you can actually become a better PA. So if you have any questions, let me know. Send me a DM. Thank you for being part of this. Hope you found this valuable. And come say hi. Let me know you're here. So that is all. Bye, guys.